Children can also experience irritability and jitteriness. You just have to assess the child for any comorbid conditions like bipolar disorder. If they do or don't have that, you can always reduce the dose or consider a mood stabilizer or atypical antipsychotic for the child. If they experience a crash at the end when they take one of these medications, you should consider a longer acting stimulant, or you can try switching them to atomoxetine or an antidepressant counter. There are also cardiovascular problems associated with stimulants because, after all, it is going to increase the child's heart rate. So you have to keep that in mind and monitor your child for that. If the child does have psychiatric conditions, you have to watch out for an exacerbation of that, such as like if they have a tic disorder, you're going to have to reduce the dosage of a stimulant compared to a child who doesn't have a tic disorder, or if they have epilepsy or any mood or psychotic disorders. Now, for second line treatments, the child doesn't, the parents or the child aren't going to be adherent with the first line, like stimulants. We give the child atomoxetine, which is a selective norepinephrine reuptake inhibitor. The dosing for that is weight-based at 1.2 milligrams per kilogram per day. And usually adolescents who weigh greater than 70 kilos start at about 40 milligrams per day. And if they do experience any GI upset from this, we usually just cut the dose in half. Another drug,
another second-line agent that can be used to treat ADHD is bupropion, which is a monocyclic antidepressant that has that works mainly via the dopamine and norepinephrine pathways in the prefrontal cortex. The advantages of bupropion include less of a toxicity from overdose when compared to other agents, which we'll discuss later, like the TCAs. And there's also a less appetite suppression and when you compare with stimulants. So you kind of get rid of those side effects when you use bupropion. And you can see the dose right there. You can go from 50 to 300 milligrams a day based on need. And you kind of titrate it as needed after consulting with the doctor. And some of the side and then, like we said, while it does have a better side effect profile, some of the side effects associated with bupropion is nausea, insomnia, rash, and tics, and there's also a risk of dose-related risk of seizures. The nausea, it can actually resolve over time with slow dosage titration, just your body getting used to the drug. The rash, it can require discontinuation therapy if it's severe. But again, you have to kind of monitor this, and it's more on a patient-to-patient basis. And it's very, and like we said before, there is the risk of seizures. So with children who have this risk, you should not use bupropion because of the associated risks. And it can also cause or exacerbate tics, which is commonly also associated with ADHD. So it can actually exacerbate that effect.
Okay, so for the tricyclic antidepressants, they're reserved for third line. We don't really use them much. Mostly we use this class of medication for children who suffer from depression as well as ADHD. Now, what trials have shown is that while TCAs are more effective than just placebo, they aren't as effective as methylphenidate or the amphetamine salts. So we usually just give them as a therapy for when they suffer from some other medical discondition as well. In children, we have to be very careful about monitoring their cardiac EKGs and things. And for dosing, we start at 50 to 150 milligrams per day, and we start usually at 0.5 to 1 milligram per kilogram per day. And we'll increase the doses tolerated up to 2 to 3 milligrams per kilogram per day. The maximum we'd see is about 300 milligrams of disapramine, but that's in adults only. And we can also see 150 milligrams in nortriptyline. And some side effects we see from TCAs are usually CNS ones, which include dizziness, aggressiveness, excitement, nightmares, insomnia, forgetfulness, irritability. They're usually similar to the other antidepressants, but one of the biggest similarities is the risk of new onset suicidality and young patients. So you have to be very careful and tell parents to monitor their children for any mood changes. You shouldn't use the word suicide with them though. And you should also tell them to monitor the children in case they stop taking it, because there are withdrawal side effects. So if anything, the child has to be tapered off of this medication. You shouldn't just discontinue it. And some of those symptoms of withdrawal would be nausea, vomiting, diarrhea. If the child takes too much of this, they can be at risk for CNS toxicity. And some signs of that would be confusion, impaired concentration, hallucinations, and delusion. And the most common ones are listed over here. It's just sedation, dizziness, constipation, heart block, weight gain, the risk of overdose, and rapid heartbeat.
Thank you. Okay, and the last line treatment for those who will need it are the alpha-2 agonists, which are guanfacine and clonidine. These drugs work at the prefrontal cortex in the brain to increase attention and focus. They basically enhance norepinephrine and its effects in that region of the brain. It's always good to tell your patients when these drugs will actually, you will see the effect in the child. And for these, it takes about 2 to 4 weeks for optimal effects to be seen, unlike the Adderalls and the Ritalin, which you will see the effects almost immediately. You see the dosing for the dosing regimens for these drugs. You take 0.05 milligrams 2 to 4 times a day, and then you titrate up to a max of 0.4 milligrams a day. And for the guanfacine, you can take 0.5 milligrams once to twice daily to a max of 4 milligrams a day. You start obviously at the lowest dose and you titrate up if needed. Again, these are last line drugs, so you always take that into account. And some of the adverse effects being that they are sympathetic stimulators, you always want to take into account the cardiovascular risk. So you want to monitor the blood pressure of the child because they are young, and you want to make sure that there's no heart issues and any renal issues and such. And also somnolence is another adverse effect.